friends, it's a privilege today to have with us senior uro-oncologist at HCG, Dr. Raghunath. Today we will be speaking about prostate cancer with him. Welcome, Dr. Raghunath.
Thank you, madam.
Doctor, before we speak about prostate cancer, a lot of us don't even know what the prostate gland is. Could you please tell us what it is and where it is found?
Yeah. So prostate gland is present only in men. It is situated in the lower abdomen, deep inside the pelvis. It is located just below the bladder. The urine passes through the prostate gland to come out. So whenever prostate enlargement or prostate cancer is there, probably it's going to compress the urinary system. So patients will always develop some symptoms because of this.
Okay. So then what is prostate cancer?
Prostate cancer is nothing but a cancer developing within the prostate gland, which is very common now. According to recent data, Bengaluru, Delhi and Pune, it is second commonest amongst men. So it is that common.
Oh. So doctor, who are the people who are at risk and what are the risk factors?
Okay. It's a very interesting and important question. People should understand about this. So persons with first degree relatives suffering from either prostate cancer, colon cancer, ovarian cancer, breast cancer and even some other malignancies like pancreatic cancers. So these family members have slightly increased risk of developing prostate cancer. We also call this as Lynch syndrome. Whenever they have history of all these things, they are at risk of developing prostate cancer. When it comes to the risk factors, age itself is a very important risk factor because prostate cancer is commonly seen in elderly individuals. The other risk factors, dietary factors and other factors like if the person is eating red meat constantly, that is one of the risk factors. Lack of exercise, smoking, all these are risk factors. So generally we call it as a genetic risk factor. Whenever family history of prostate cancers are there or breast cancers are there, they are at more risk of developing prostate cancer.
So what are the signs and symptoms that one needs to look out for? The early signs or the late signs and symptoms?
Unfortunately, in stage 1 and stage 2 of prostate cancer, meaning to say if the prostate cancer is confined only to the prostate gland, that is, we call it as early prostate cancer. So person will not have any symptoms during first and second stage. So the symptoms will come only in third or fourth stage, or we call it as locally advanced or advanced stage. So very important point here to understand is during first and second stage they will not have any symptoms. So person should not look for any symptoms to diagnose prostate cancer. So as I told you, in first stage and second stage they will not have any symptoms. In locally advanced or metastatic disease, person can have difficulty in initiation of the urinary stream. The slow stream will be there, increased frequency can be there, sometimes blood in the urine can be there. In advanced stage disease, where the disease has already gone to the bones, they can present with back pain. This is the commonest symptom.
So can one screen for prostate cancer? And who should get the screening done?
Oh, this is very important point because only by screening we can detect prostate cancer in first or second stage. So without screening, it is difficult to identify this cancer because they will not have any symptoms.
Right.
So screening is very important point. Who requires screening? The person with family history of prostate cancer should start screening from the age of 40 years. If the family history of prostate cancer is there, or if the family history of breast cancer or other malignancies are there, so they should start screening from the age of 40 years. Yearly once PSA is recommended. So otherwise, if there is no family history, if there are no risk factors, so person should start their PSA screening and rectal examination to examine the prostate from the age of 50 years, yearly once. So this is recommended by various urological organizations, to name American Urology Association, European Urology Association and even Indian Urology Association recommends PSA screening for all men after the age of 50 years if they don't have family history. If they have family history, they should start screening from the age of 40 years, yearly once.
So doctor, in case of prostate cancer, what are the various treatment options that patients have now?
We have various treatment options. To begin with, very small percentage of Indian men will have very low risk disease or low risk disease. Maybe it may be 3 to 4%. In the West, it will be up to 30%. So if the person's risk of having prostate cancer or having low risk prostate cancer is there, they may not require any treatment. We call it as active surveillance. When they have intermediate risk or high risk prostate cancer, which most of our Indian population belong to intermediate and high risk prostate cancers, so they require active treatment. What is the meaning of active treatment? So there are two active treatment options available in India. One is surgery, the other option is hormone therapy and radiotherapy. I will explain these two options. When it comes to surgery, the open surgery is there, laparoscopic and robotic surgery is there. Now, the robotic surgery has become standard of care. The advantages of robotic surgery is less blood loss, less pain, early recovery, and overall better outcomes in terms of cancer control, in terms of urinary incontinence and sexual dysfunction. All those things are better with robotic surgery. When it comes to radiotherapy and hormone therapy, these are generally required for localized prostate cancers. So we have IMRT, IGRT, tomotherapy and cyberknife treatment options at our place. So these are the two broadly, these are the broad treatment options available in India right now. If the person presents with advanced stage prostate cancer, we call it as metastatic prostate cancer. In such cases, it is not possible to cure, but definitely we can control the disease and we can prolong their life by giving hormone therapy, and we have a couple of drugs which are called second line hormone agents, and in the later part of the disease we may have to consider even chemotherapy. So hormone therapy, second line hormone agents, chemotherapy and even now PARP inhibitors are available. So with these we can definitely control the disease in a better way to give them good quality of life and better survival.
So doctor, do you have any take-home message for our audience today?
Yes, of course. My message is all men after the age of 50 years should undergo PSA test, which is a simple blood test, and rectal examination. And if any history of family history of prostate cancer or any other cancers are there, the men should start their screening from the age of 40 years. That's my message.
Thank you, doctor, and thank you for joining us today. If you want to reach us, please do write in the comments and we will get back to you. Thank you.
Thank you.